Good morning. I'm Anne with Maternity Wise International, and I'm here with Jason Ayala, and he is a newly trained doula from Connecticut. And we had some questions for you, Jason, because being a man in the birth space can be a little bit tricky. Sometimes people don't receive it very well, and sounds like you've already encountered um, a little bit of feedback from people. You want to share that first of all?
Yes. Well, good morning, and thank you for the opportunity to just speak with me and just get some of um my views and kind of my thoughts around what being a male doula is and what got me into it. But I know when I initially announced that I was going to be pursuing becoming a labor doula, there was a lot of praise, being that by trade, I'm a massage therapist and I've been doing prenatal work for several years. So a lot of the mothers that I've had, they said, next pregnancy, you're definitely going to be my doula. I want to work with you. I would have loved that for my previous pregnancies. And then there were some people that may have been a little biased as to, what type of support I could provide, being that I'm a male, I could never experience giving birth, or they felt like it was something that just only women should be able to do. And one of the biggest motivators in me wanting to become a male doula was when I initially thought about it, I didn't know if it was something that men could do. And you're probably familiar, there's a article that circulated about a man of color that was just growing as a male doula. I want to say he was out of, I may have been like Chicago, but I read an article on him and kind of just popped up somewhere on social media. And I was like, okay, there's actually men that are getting into this field. And a part of it is being that sometimes not only the mothers need the support, but the fathers need support too, because they don't know how to be there. We're coming from generations of men of color and just people of color that don't necessarily know how to navigate these things. And they're going off of what they were told, whether it's from medical professionals or just what they hear. And they go through difficulty when it comes to having children and just labor, and they have bad experiences as is without having to deal with pregnancy, just in general with healthcare needs. So imagine in that type of setting where you may not be seen by somebody that looks like you, understands your struggles, understands different things, understands cultural cultural decisions that may come up. It i felt like it was just so important to be able to be a voice in that. So I understood the backlash with some things, because of course I'm never going to be able to give birth to a child. But as a massage therapist, I know so much about the body. I work daily in alleviating pain based off of intuition, based off of assessment of different things that they're going through, and also going through the different anatomical changes that we have. So if I know that as a mom, there's a ton of changes you have,
One of our books, yeah.
yes. There's so many changes that you have throughout pregnancy, especially when you're talking about the pelvis and just the pelvic floor, so many different areas that are affected. Then of course, with what I know, I can help them guide, or just get through that pain, get through those adjustments, and make it as seamless as possible for them. So they're not struggling, they can understand their bodies a little more and not just decide they want to be sedentary, keep them moving, keep them mobile.
Yeah, and actually, it's funny because you brought up dads, and I have had the question asked of me as a female doula, like, are you trying to replace the dad's role kind of a thing? And I can imagine that even more so as a male doula, you're going to get that kind of
Yeah.
question. And so, how do you see yourself interacting with a male partner in the room?
Well, so I'm lucky to have my first clients being my friends. I have friends that I actually introduced to each other. So I knew the husband prior, I worked with the wife prior, they're expecting, and they both said they like it was a decision from him and from her. We both want you there. One, because they trust my knowledge around being able to make it as painless as possible, help them, navigate those things, but also just sharing insight about information that I'm finding and things that I can share with them, so where I can support him and guide him through, okay, this is how you should help her through it. Because even when I'm doing, let's say, like prenatal massage, and she's like, oh, you need to show him this. Like, can you show him how to do this? Because they, of course, I'm only coming ever so often, but they're living with each other. They're going through it. So when there's sudden aches and pains that might come up, then he can learn how to help support in some of these areas. When we come to the time where labor's starting, there's that time where I may not be there right there when the water's breaking. So like being able to help her, support her in that time period, it gives him a little more confidence in being able to support her, because especially as a new parent, what are you going to ask your parents that if you're, especially you're a little older, your parents are older, they may think they know everything that's going on, but our bodies are changing. So the way healthcare was 20, 30, 40 years ago is not what it is now. So you can't compare the two. So it's not the same. Doctors treat things the same. There's different terms that moms and dads need to know about. So if mom's not able to make this decision in the moment, dad has to be able to make that decision or be able to know what's going on and not being completely lost. Sometimes dads don't even have the chance to go to these appointments, and things come up to where they're not able to know all these things. Some dads might do the research and look it up, but just to be able to, walk them through these things will help them so much to prepare to step into that role and realize that it's not just something the mom is doing. You play a key role in it as well, and your presence there, your knowing in how to support is important as well.
Yeah, all the preparation. I'm always so huge on preparation. I'm like, you
Mhm.
just want to prepare them so much, because even though hopefully you're in the room with them at the time, sometimes you're not. And sometimes there's decisions that need to be made ahead of time or even in the moment where you don't really have time for like a long discourse on why this has benefits or this has risks or what the alternatives might be. And so to prepare them ahead of time, and then you're just giving them snippets to remind them of what they already know, it makes such a huge difference. And I feel like, whether you're working with them intensively as a massage therapist beforehand, or you're working with them just as a doula, you have such a great opportunity to provide education and, like I said, like just preparation of their mind, as well as, physical things that they can be doing to get ready, and things that you can be, providing for them, like massage techniques. I love that. I love the idea of teaching dads massage techniques, because when it comes to labor, a lot of times I'm like, okay, my arms are jello now. I need you to take over. This is, you've been watching me do this for 3 hours. So can you do the thing?
Yes.
So it's always really good. Um, I wanted to ask you too, what do you feel like has been your greatest struggle, as far as, just becoming a doula at foundationally male, female, just becoming a doula? What do you feel like has been your greatest struggle so far?
I would say the greatest struggle, I think, just trying to because navigating things that are out of control. So there's, you would think that with working with families, there's just, okay, we're going to set these things and you follow that. But of course, there's other elements that are going on. Life, this, that. I have a mom that wants services and is also going through a divorce.
Oh,
So there's also the emotional aspect that you also have to prepare for and deal with and help, and sometimes they want to have that support too, which you do have to do that. So it's taking on that side of things as well. It's not just the physical of, I'm going to prepare you for the process of labor and help you through these stages throughout your pregnancy, but there's also the other side of things, and maybe there's fear that's coming up and trying to navigate that, finding that balance and be able to do it. Because now you're taking on, especially for working with several, mothers, different, times of due dates, but there's giving them the amount of support that they need, setting those boundaries too, of knowing, okay, like this is like the threshold of it, because I'm no counselor. I can't do, I don't want to do something that's out of my scope of practice. So just making sure I'm staying within my scope in that sense of, okay, these things are going on. Well, I can't provide all of these services. And I think that as people that like to help and want to be supportive, it's very easy to get drawn in. And
Yeah.
then just realizing, this may be something that's bigger than what I can, deal with. And I can give you these resources that can support you with it, but I necessarily can't provide all the support for it. So just making sure that I'm setting those boundaries, and also just setting that clear intention beforehand. Okay, this is how I can support you. And then in these areas, how about we look for ways to support you, that, whether it's services, whether it's leaning in on somebody, that's close, to be able to offer that extra support. I think those things come up a lot throughout on those conversations, and also dynamics of the relationships with, the mother and their partner, and figuring that out as well.
So you mentioned, so I think that's great. And scope of practice is really important.
Mhm.
But when we have multiple skill sets, when we're bringing to a
Mhm.
labor, sometimes that area gets a little cloudy and we have to say like, okay, I'm taking off my doula hat
Yep.
and my something else hat, right? So tell us, what other skill sets are you bringing for your clients? What kind of things can you do besides being a doula?
So before becoming a doula, I've been a licensed massage therapist for the past 7 years, about 6 of those being a prenatal therapist. So I've been doing that for quite some time. Also am an assisted stretch therapist, so I can incorporate different stretching, helping navigating that. I did pause studying corrective exercise, but probably by the time that I do finish working with all my moms, finish school for aesthetics, which I'll be
That's so
studying throughout this year, I will be a massage therapist, a corrective exercise specialist, an esthetician, and a doula, all
cool.
at the same
That's
time.
so
And
cool.
I, so my ultimate goal, of course, my business has generally been about massage, but I always knew that I wanted to go more of a holistic approach and be able to provide different services that were able to meet different needs. So, especially when it comes to being a doula, I can help with massage, with generally, because of how the healthcare system is now, I wouldn't be able to go do a massage while somebody's in labor, just drop in for an hour, work on them, and then leave. As a doula, now I do have access to use what I've been trained for in that setting, because most people in my area don't really do home births. There's some that people do, but it's in different counties, different areas. It's not really accessible to mothers in the area. But then with corrective exercise, what a lot of moms deal with is pelvic floor imbalances, or they end up just struggling with hip strength, so many different areas that are affected afterwards, even their core strength. So with the intention behind that is being able to support them with correcting those imbalances that they have in their body. And a lot of times moms need to strengthen a lot of the muscles. Some of the moms, that end up having a cesarean, at some point they're going to have to strengthen their core. So helping them work through that, helping them navigate the changes that they went through in their back, their legs. Maybe it changes their gait. It may not always work back to how things were. Things end up shifting. So being able to support them with that as well. And then something that always changes, which I'm pretty sure moms realize it. They talk about babies taking their beauty and pulling things out, but it's skin. Your skin changes, and being able to provide support in that as well, to where they can learn healthy skincare practices to keep their skin as best as possible, but not only just for the face, but their belly. So many moms worry about stretch marks and how their skin adapts to the pregnancy. And some moms have great experience with that, and some moms don't. So wish I had something shared with me a couple of months ago before, I was really trying to figure out if I wanted to go to school or not. And it was a belly facial, which I thought was awesome. And I think that there's so much tightness that comes into the belly. So just being able to do things like belly sifting, doing the facials, it will help to just bring so much comfort to the skin, keep it supple, keep their skin healthy so that they can really have those nutrients brought into the skin that will help them restore it.
You could even be doing like Lessing Way type, even if it's like a baby shower, doing facials to all the ladies, but then a belly facial on the mom. I mean, I'm like,
Mhm.
my business brain is
Yeah.
just going tick, 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 tick. I have all
There's
these
so many
ideas.
different
Like,
things
there's so
that
many
could be
ways you
done.
can use all these things. It's
Mhm.
just really cool.
There's so many different things that can be done.
Yeah.
And, I haven't necessarily pursued a certification in it, but I have experience in it is pediatric massage. I've worked with a 1 year old for quite some time that was born with some issues, um, some muscular issues, and was able to just work with the baby in doing that. So I know that along the line, that is a certification I will want to do, because sometimes you have issues that come up. Maybe there's an
Yeah.
imbalance that comes up in the shoulders, things that happen there, and babies just need to to relax as well. So be able to show moms how to massage them, especially if they're dealing with gases and things of that nature. Being able to support them in that way would be great too, just to add some, a little bit extra to where I can share with them some information, some best practices, so that they can help their babies be relaxed.
That's awesome. Well, I really appreciate you spending time today, talking about your role, talking about how you plan to practice, and how you already are practicing, and just sharing your perspective. It's really, really important. It's interesting
Mhm.
also. And I think that it's a side of the doula world that needs to be, explored, as far as like, what does it mean to be a male doula? What does that look like? How do you,
Mhm.
and like you said about boundaries, that's, I think, a really big deal, because um, I think one of the concerns is, it's a guy and with
Mhm.
somebody else's, wife or partner, and it's like a healthcare practitioner,
A
is a
lot of
healthcare
people
practitioner,
confuse
so
doulas with midwives. So that's a common misconception that I have to kind of like, iron out, because they're thinking that I'm going to deliver a baby. I'm not
but
delivering a I'm not
there's male
delivering a
OBs,
baby. Yeah.
there's male OBs out there.
But,
So
and the thing is, it doesn't bother me as much, because this is the same type of um pushback I get as a massage therapist. So whereas I do have probably more than 75% of my clientele being female, I still deal with people saying, "Oh no, I don't want a guy touching me." And I'm like, you have male doctors, you have male, you know, OBs. Why is it an issue if we're talking about modesty in these services and the focus is addressing your needs? So things are done to your comfort level. And that's the same thing with being a doula. I'm working to your comfort level. So it is, what are you looking for from me? This is what I can provide to you. And if you're not comfortable with this is fine. But just understanding those limits that are there. But at the end of the day, a big issue, even with having both parents there, you know, I had moms that had major health complications that developed infections while in labor, because the doctors or the nurses was like, you're fine, because of course nothing was going off and beeping. But mind you, her temperature's dropping because she's going septic, and then she just passes out. And they don't realize it, and then the baby's born with an infection as well. So it's like there's things that, okay, how are you feeling? if no one's really checking with the mom's saying, hey, this is what's going on, and no one's able to say, okay, we need to go navigate this, because sometimes you're like, okay, well, the doctor said I'm fine, I guess I'm fine.
Yeah, and we
How
rely
many
so heavily
times?
on these machines that, it's efficient because if you're a nurse and you're responsible for multiple patients, having everyone on a machine and you can see their heart rates going, then it seems like, okay, well, everybody's good. I can watch 4 people from the desk, because they physically can't get in there and do their job of personal care, which I'm sure all of them want to be doing, would prefer to be doing, versus, a lot of paperwork and putting things into the computer. Like, people don't get into nursing because they want to push paper, or type on the computer.
Mhm.
They get into nursing because they want to care for people. Well, I love hearing your level of professionalism, and I appreciate you. I really am glad that we were able to do this interview, and we'll be getting it up on the blog soon. So is there any last words that you want to say before we say goodbye?
I mean, if anybody wants to follow what I'm doing, follow adding all of these things, I would love to continue to share that. You can follow at It Is Wellness MT. That's my name for now. I will be changing it as I develop everything else. But right now, that's where you can find me on social media. I definitely love to just talk to people, and I'm going to be sharing a lot of the process that I have with moms, and just share those stories, because I think it's really important just to be able to get that perspective. And just, I feel like, I went through one birthing experience with my niece. I was in the labor and delivery room, and I saw things that I'm like, I don't, this is years ago, but it's like, I don't think this is how things are supposed to work. And having something like that happen made me really start to think, okay, well, how is this supposed to pan out? Or how should it? How could it? So being able to experience it, and also through the resources that I have through Maternity Wise, the books that we've had to read, it's shared a lot of insight about different experiences, and I can share this with my mothers, because there's so many misconceptions that we hear in this day and age. A lot of it is opinion, and a lot of it is in fact based or research based. So just being able to share that and be able to support them in any way, shape, or form to make it the best experience for them, I think that's the most important thing.
Awesome. Well, thank you so much, and so glad that you were able to be with us. And I have a feeling we'll circle back around to this issue again at some point in the future. I want to see how you're doing in the future, and we can talk more about how you're received at the hospital and all that, as you get more busy.
Yes.
All right. Well, thank you, Jason.
All right. Thank you.